wonderful episode of the Reflection Show. Today, today's topic has really kept me thinking if a lot of us have actually been practicing this or we're going to pretend, and if really we're going to reflect on today's topic and make sure that we change. We want to look at how to keep a healthy mouth. And looking at the mouth, we're looking at the teeth, the tongue, and anything in the mouth that needs to be kept clean. How many times do you brush your teeth in a day? Do you brush your teeth before you go to sleep? And when you wake up, do you eat before you brush your teeth, or you brush your teeth before you eat? And which way is the best way? I will be speaking with Dr. Cephas Ayogani. He's a dental surgeon at Cornerstone Dental Practice in Tamale, opposite Scaraba Lodge on the Bolga Road. He'll be helping us to understand everything that we need to know about our teeth, our mouth, the best way to brush it, how parents can also help their children to brush their teeth. Let's go for a break. When we are back, the discussion continues. I am Martha Nabila. Do stay tuned. Thank you very much for staying tuned. Before we get into the discussion, I want to say a very big thank you to the Pest Beauty Salon for my hair, Makeup Marvin for my makeup, Root Suits and more for my beautiful outfits, Ellie's Collection for my shoes, and Tilium Industry Limited for the refreshments on the show. So Way Medical Center, thank you very much for supporting us. Event Happen GH for our beautiful furniture on set, and Dio Restaurants for giving us sumptuous meals anytime we have an episode to record. I will be speaking with Dr. Cephas Ayogani. He's a dental surgeon at Cornerstone Dental Practice in Tamale, opposite Garba Lodge on the Bolga Road. So after the discussion and you want to see doctor, you want him to help you with anything dental care, please get in touch with him. Thank you very much for joining us on the show, doctor. Always a pleasure to have you.
Thank you so much for having me today.
Okay, so quickly, straight to the topic. Why should my mouth be a concern? Every day I've been eating, so it keeps opening. Why should I spend much time taking care of my mouth?
Thank you. The mouth is a gateway to the body.
Okay.
And a healthy mouth actually resides in a healthy body.
Okay.
So if you have a healthy mouth, invariably you have a healthy body.
Okay.
What you pass through your mouth, in effect, is what you are made up of. The food you eat, the nutrition you take, what is good for your body, all has to pass through your mouth. So the mouth is very important, not just for the health of the mouth itself, but the overall health of the body. Yes.
So when we look at the mouth from the lay person's perspective, I can say I know I have the teeth and the tongue.
Right.
And the teeth or even the tongue, we are told to always brush it all the time.
Right.
Can brushing alone make my mouth healthy?
No, but it is a starting point.
Okay.
The mouth is made up of the teeth, which are the hard structures in there. You have the tongue. We have other structures, the soft tissue. You have the palate, the soft palate, and of course salivary glands that open into the mouth to produce saliva. When you are eating, they mix with the food. Digestion actually starts in the mouth.
Okay.
Because the saliva that you produce that mixes with the food, that is where the digestion starts. So it is very important that you keep those structures all healthy. Now, brushing your teeth is a starting point.
Okay.
But when you eat, food particles remain on your teeth, some in between your teeth, some on your tongue. Then there is a build-up of these, and the microorganisms that are in the mouth will act on these things, and then if they are not taken care of, it can lead to infection of the soft tissue as well as the teeth themselves.
How often should I brush my teeth?
Ideally twice in a day.
Okay.
You brush in the morning and then you brush in the evening. It should be the last thing in the evening before you go to bed, because you will realize that when you go to bed, most people will go to bed maybe around 8 o'clock, 9 o'clock, and then you probably wake up around 5 a.m. Look at the number of hours that
your
your
mouth
mouth
is
is
closed,
closed,
not
not
doing
doing anything. It's not
Yeah.
talking. And once it's not
Eating.
talking, saliva is not flowing. Saliva flow is actually a cleanser.
Oh, okay.
So once saliva is not flowing, the mouth is stagnant. It means that it's not being cleaned naturally. So oral bacteria begin to act on any particles that are in the mouth, and then they generate some acid. The acid will dissolve the hard tissues of the teeth, and that is what actually leads to cavity development.
Okay.
So brushing your teeth in the evening will take care of that, remove all food particles that are there. So the bacteria that are there will not get anything to act on to produce the acids that will dissolve the substance of the tooth. Any other thing that is on your tongue is removed. Any other particles in the mouth are removed. So you have a healthy mouth. In the morning, because your mouth was closed and there was no activity, there's a buildup of what we call plaque. Plaque is some soft, tiny film of saliva mixed with bacteria. Usually, every morning, everybody would have that coated on the teeth and on the gums. That is full of bacteria. So in the morning, you need to clean your teeth.
Before you eat, or you can eat before you brush your teeth.
Ideally, you brush before you eat.
Okay.
But if you have eaten, you still would have to brush.
And those bacteria that we are talking about, like in the night, so because you don't do anything, bacteria kind of come into your mouth. When you eat, they don't the food push the bacteria into your stomach?
The bacteria in the mouth are what we call normal flora or normal microorganisms. So they are there in a balance. There are so many of them, so they kind of keep themselves in a balance, and the mouth actually needs them. Now, when your mouth has food particles in it, it feeds certain microorganisms for them to grow more. So when they overpopulate the others, then the balance is shifted. So then they become dangerous to the tissues in the mouth. But if you keep the mouth clean, they are normal and they are there and they don't cause problems.
Okay. You mentioned cavities. Is it what the layman would say, that there are sores or there are something in your teeth? Let's say like the kids, young people, children, we see them that like their teeth, there are some black spots that come, like we say that when they eat a lot of sweets.
Right.
Is this one thing that causes the cavities?
Right. So the cavity is actually on the tooth. The tooth is a hard substance. It's actually the hardest substance in the body.
Okay, I think
If
we have
I can take
can
this.
do this. Okay.
So this is how the teeth are.
Okay.
This is an adult. So we have 16 set of teeth up, then 16 down. I will come to the children shortly.
Okay.
So if you look at the teeth, they are not smooth. There are what we call pits and fissures.
Okay.
It is that way so that it can grind. You know, if you have ever seen the blades of a grinding mill, they are not smooth because they are supposed to grind whatever you put there.
Yeah.
So that's why these teeth are not smooth. They have pits and fissures so that you can chew and then grind to the consistency that is desirable, then you swallow. Now, because there are pits and fissures there, when you eat and then you take something that is sticky, like sweets, biscuits, carbohydrates, and then they stick there, you don't brush your teeth. They remain there. And once they remain there, the bacteria, the normal bacteria in your mouth would act on that. It's a food substance.
So they
a
remain
substrate.
in the
In
inside.
between.
Okay, in between. Okay.
Like what I call the pits and fissures. So the bacteria will act on them. They are eating the food in your
They're
mouth.
creating holes.
So they will dissolve that food. When they dissolve, they produce an acid. The byproduct of what they do
Oh, okay.
is to produce an acid. Now the white part of the tooth, which is the enamel, is made up of minerals.
Okay.
So the acids, when it accumulates in the pits, it will begin to dissolve the mineral component of the tooth.
Okay.
So once it dissolves it, it gets into the inside. The inside is softer. So once it gets into the inside, bacteria gets there, and that inside becomes food again for the bacteria. So the bacteria will continue to eat and eat, and then you begin to have pain because the inside of the tooth has nerve ending. It has sensation. You can feel.
Okay.
So once it gets there, then you have pain beginning to come in. You have sensitivity. You take something cold, you feel it. Take something hot, you feel it. The pain comes on and off until it gets to where the blood vessels and the nerves are. Then you have constant pain. You can't sleep at night.
The down part of the teeth is called what?
The teeth, we have a set of 4 teeth at the front here, which are the incisors. The next one here and one here are the canines. Then you have 2 here and 2 here, which are the premolars. And then the last 3 here.
The science I forgot in senior high school.
And the last 3 here are the molars.
Okay.
So for an adult, we have 3 sets of molars on either side, left and right. Then 2 sets of premolars on either side. Then 1 set of canines, and then 4 incisors.
Okay.
For both the upper and lower.
That's 32.
That's 32.
Okay.
For the children, they have just 20.
Okay.
Right.
Wow.
So the children have the incisors, they have the canine, then they have the molars. Just in total 20 teeth.
Okay.
Yes. So what you usually see as dark spots on the children's teeth are a sign that some cavitation is starting.
Okay.
There is dissolution of the enamel, the white part. So the cavity is beginning to develop. Usually when we see them at that stage, what we do is we just scrape off that dark portion and we put something that is compatible with the tooth substance to seal it, then it stops there. If you don't do that, it continues to progress until it gets down there and then pain starts.
So with children, it means that we have to reduce the way we give them sweets.
Exactly. And the timing too. We usually advise that children who are given sweets, they should eat the sweets at meal time instead of eating them at a separate time. Because when they eat at meal time, they eat the sweets and they eat their food. They kind of cleanse whatever sticks on the sweets that get stuck on the teeth. They will clean it. Yes. But if, let's say, you eat it at any time, and mind you, the sweet has sugar, and the sugar is actually carbohydrate. So that is what the bacteria is going to act on to produce the acid. It's already refined sugar. So it makes it easier for the bacteria to act on it, and then it will lead to cavitation.
Okay, so all of these can be prevented, reduced when we brush very well.
Exactly.
Okay, so I'm seeing, or let me say, with what I'm seeing, or with some of the little research from a lay person's perspective, we know of brushing and flossing.
Right.
Sometimes we don't even know what it means. We just know, like, okay, I'm going to brush my teeth and I'm done. What is the difference between brushing and flossing my teeth?
Thank you. So brushing involves using a toothbrush and a toothpaste.
Okay.
Before I go, let me just add that a toothpaste, we usually recommend toothpaste that has fluoride. The reason why we recommend fluoride toothpaste is fluoride is an ingredient that helps to strengthen the teeth.
Okay.
So when you use that, it strengthens the teeth, especially in children, so that the teeth become strong and resistant to the acid attack. Now, for children between the ages under, let's say, under 6 years, no, under 3 years, we recommend that the fluoride in their toothpaste should be about 1,000 parts per million. The fluoride is measured in a scale we call parts per million.
Okay.
And it's usually written in the pack. When you are going to buy your toothpaste and you look at the pack, you see it written.
So any toothpaste one is going to buy.
Yes.
We cannot recommend any toothpaste for you because there are a number of them. So just make sure that the ingredients that doctor is mentioning, it's available in those.
Yeah, so the fluoride. So for children below 3 years, it shouldn't be more than 1,000 parts per million. 3 to 6 years, it can increase to 1,350 parts per million. And then 6 and above to adults, they can take up to 1,500 parts per million.
Okay.
Now, I'm going to start with children.
Okay.
Even brushing or cleaning the mouth should even start before the baby's first teeth come out. And that's one, you don't do it with a brush.
Okay.
You can do it with your finger, you can do it with a cloth, with a piece
Or
of
cotton.
cotton or gauze. Clean
Okay.
one, of course,
Yeah.
with water.
Oh.
That is teaching your child to get used to the cleaning. And again, that would make the mother conscious of the cleaning of the child's teeth. Now, the first teeth that come out usually will come around the age of 6 months. So from 6 months onwards, you begin to use the paste. In our part of the world, again, I have to add that certain areas within Ghana already has a lot of fluoride in the water they drink,
Okay.
the underground water. If we take northern region, somewhere in the Saboba Chiripone area,
Okay.
there are communities there with a lot of underground fluoride in the water.
Okay.
Then the Upper East Bongo area also has that problem.
Okay.
Now, because of that, we usually would, if you come from those areas, we would recommend that for the kids, don't even use the fluoridated toothpaste.
Oh, okay. My hometown people, we are having our natural fluoride already, so
So for the
we are
children,
good to go.
do it with a fluoride-free toothpaste,
Okay.
because the tendency is for them
Become
to
too
swallow.
much. Okay.
Children will swallow.
Okay.
And because you already have too much of the fluoride in
our
your water,
water.
you don't want to add more.
Yeah.
So just go with a fluoride-free toothpaste, because they already have enough
Yeah.
in the system.
Okay.
Now,
I don't want to cut you. I want us to go for a break. When we come back, we want to delve into really how to brush
right.
the kids. Do stay tuned. We'll be right back.
My name is Dr. Emmanuel Campbell Ujaki, the CEO of Zoe Medical Center, Tamale and at Brownville. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we can.
Yele, yele, yela, yele. Praise the Lord, oh. Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of
Oh, yeah, sing to
God.
the glory of God.
Sing to the glory of
Oh, yeah,
God.
sing to the glory of God.
It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go.
Welcome back to the Reflection Show. Before we went on the break, we're looking at how we can brush our teeth, how we can keep our mouth healthy. I have been speaking with Dr. Sefat Ayugani. He's a dental surgeon at Cornerstone Dental Practice in Tamale. It's opposite the Garaba Lodge on the Bolga Road. So you can always go to Cornerstone for all your dental health needs. For amazing services, always see Dr. Sefat for the best. Now let's look at how to brush our teeth. And this one, I really want you to take your time and let my viewers see, because sometimes we just put the toothpaste and so we're in a hurry and we are gone.
Right. So this is my brush. So you would put
Have
the
the
toothpaste
toothpaste, yeah.
on the brush, there are two ways of going about the brushing. I
Okay.
would go with the first one first, which is my favorite.
Okay.
You would open the mouth, brush the lower teeth separate from the upper one.
Okay.
So with your brush at an angle of about 45 degrees
Okay.
to the tooth,
Okay.
you would move gently
Hey.
with a bit of minimal pressure.
Okay. Like you are dusting
Yes,
the dirt out of it.
right. This way you remove all particles that are wedged in between the teeth, where we call the interdental spaces. So you brush like that, okay. Then you come inside again at that same
The
angle.
upper lip
Yes,
down
inside.
the inside.
Then you brush, you come forward, you come forward, you come forward, and you
Okay.
brush. Then the chewing surface, that is the molars.
Yeah.
Then you go that
Go
way.
down.
You go that way. Then the down, the
Same
same
thing.
45 degrees. You brush, you brush, you brush. Then you come inside, you brush, you brush. Then you brush the chewing surface. And then the last thing, you brush your tongue.
Okay.
All this should take you about 2 to 3 minutes.
Really?
2 minutes.
I'm
at
trying
the
to
minute.
imagine how
Don't-
some people would
you
just
don't-
do like.
You don't do like that for just 1 minute.
I believe you
The
watching me
pause-
there. You're also a victim of this because this thing you are doing. Okay, I've repented. I
Right.
will take my time.
The,
Okay.
the other way is to do what we call the circular motion. That way you can
Okay.
bring the teeth together
Okay.
and do the circular motion. Circular motion.
I don't see you talking about the what do you call it? The gums, or how do they call it?
Yeah, the gum.
Yeah, okay.
That is, yeah. So when you are brushing, that way you are actually starting from the,
The
gum
gum.
to
Okay, up to the teeth itself.
You see, so you are brushing from the gum to the teeth at an angle of 45 degrees. Okay, that way. The same way, the circular one, you are brushing from gum to teeth, gum to teeth, gum to teeth. Then when you finish, you brush the inside, open brush here, brush here, brush here, brush here, brush your tongue. And then
So the tongue too. Do you take your time
you
like
take your
that?
time to brush, not so hard, but gently. Make sure you remove. Because the tongue has a very large surface area and it is rough. So when you eat, food particles, fine food particles stay there. And then if you don't clean it well, it can give you what we call bad odor halitosis. So
Okay.
people who have bad odor,
They have to check the way they brush.
yes, they check the way they brush. Maybe they are not brushing their
Their
tongues
teeth,
well.
yeah.
Especially at the last 1/3.
Okay.
Posterior 1/3.
Like towards the throat.
Towards the throat.
Okay.
You have to be gentle and brush that part well. Right.
Okay. That's brushing.
That's brushing.
Let's look at flossing. What is flossing?
Flossing is a floss is just a piece of dental thread
Okay.
that is made for the purpose of going in between the teeth. The
Okay.
brush I was showing you, you realize that it will be difficult to go in between the teeth to clean
Yeah.
any particles. So I will show you on our.
Yeah. What we have here.
So you have the floss here.
That's like a rope.
That is like, yeah.
A thread,
Thread.
rather. A
Yes,
thread.
thread.
Yeah.
So it's a special kind of thread.
Oh, okay. So you can't use any of these.
You can't
things.
use any.
Please, my people, I was thinking of how to use the thread in my house to do this. But please, it has a special thread to use
Right.
to do this.
So
Okay.
you would, unfortunately, in my haste to come,
Yeah,
I forgot
okay.
to bring some.
So what's
you-
the name of the thread?
It's called dental floss.
Okay, so
And
probably
the
get to
process
any
is
medical store.
Yes.
And you
A
say you want a
pharmacy,
pharmacy
you want
dental floss.
You should get it.
Okay.
Right. So you roll it around one finger,
Okay.
more of it on one finger, then use the other finger to hold.
Okay.
Then you go. This is the second picture.
Yeah.
You go in between the teeth.
Okay.
Push it down and move it up. Push it down
Ah.
and move it up.
Like-
so yes.
okay.
So any particles that are in between the teeth, you
They will
move
come,
them.
yeah.
It will come out. Then the same way here. There are sometimes some people their teeth are so close together, the thread or floss cannot go in. So you can see this one It's like threading a needle and passing it through. It's something that you can use to pass through in between for those who are so
very
tight
close, yeah.
that you cannot push the thread through. So you pass it, you thread it through there, and then you clean. So
Okay.
basically that is flossing,
Okay.
right?
And it's like the brushing
This is
aspect
the
that you
brushing
had
aspect
already done.
that's, yeah, we demonstrated, right?
Okay, I think that this part that's where you mentioned. So you turn the brush and
Yes,
and
and then
brush
you brush
that
the inner
side,
part
inner
of
part.
the teeth.
Okay.
Right.
So the name of the thread is dental floss. So
The process is flossing.
okay, so if you want to go for this, when you get to any pharmacy, just say you're looking for dental floss, and they'll get it for you. And I believe that for beyond this, if you forget that, I hope you don't, you can just get some of the videos on YouTube that would help you to
To learn how
floss.
Yes.
how to floss.
Let me just add that children, usually we recommend that parents do the brushing for them.
Okay.
So your child up to the age of 6 years, you should do the brushing. But after 3 years, when you brush, give them the brush to also do it. So
Okay.
they start to learn how to do
Learn
it.
how to
They will not do it well, you will do it well.
yeah.
So you do it and give it to them to also do it. From 6 years, they are good to go. They can do it themselves.
Okay.
Right.
You mentioned that from 6 months, the tooth of the baby starts coming out.
Yes.
So they can use the white cotton and all of that.
Right.
But sometimes, like I've heard a lot of breastfeeding mothers complain that the first 1 or 2 tooths that come,
Right.
it's very strong. That even whilst they are breastfeeding and the baby just bites, it's very painful.
Right.
Why is that like that?
It's not that it's very strong. The teeth are strong generally. You started with a baby who didn't have any teeth with gum. They when they are sucking, they bite. But when they used to bite you with
The
no
gum
teeth,
alone.
you were not feeling it. Now you have 2 pointed teeth down
Ah,
and 2 pointed teeth
imagine.
up. So when they hold and bite, you will feel it. So occasionally it happens. They can bite you, but it's part of the motherhood, I think.
Okay.
The only worry sometimes is that we should actually have is
Yeah.
when the teeth are erupting and then the gums get inflamed. What the
Okay.
parents call teething, temperature, and all that is because you don't clean around the gum, especially when the back ones are coming. Then the gums get inflamed, then the baby gets temperature. So we advise that you use a cloth to clean, to make the place clean, and then
Okay.
that will minimize temperature during teething.
Okay. The dental, let me say, organization, dentists. We as people, why is it difficult? Because I can easily walk into a hospital and say I have malaria, etc. But I have never walked into a dentist hospital to say check my teeth for me. Why do you think is the problem, and why it's important for me to visit the dentist as much as I want to visit the hospital to check for malaria?
Right. It should be a routine for everybody to do, but unfortunately, I think it has to do with our upbringing. A lot of us grew up without seeing a dentist in our life. The first time probably we saw a dentist was when we were grown up.
Had some
We had
caca
some
in us.
pain that had to force us
To the
to the dentist. The other thing is that the dentists are still few in the country. There are so
Okay.
many areas that do not have dentists. For instance, if you take northern region, outside Tamale, you will not get any dentist in any region.
Wow.
You have some few dental facilities that are manned by other dental manpower. But again, there are few. I don't think up to now they are even up to 3 or 4. So it means that if you are in a place far away, you cannot access dental care.
Yeah.
And then our upbringing too, we are not used to doing it.
That's
so we
true.
wait until there is pain.
There is
But
pain.
actually, we are trying to create awareness that
Okay.
you don't have to wait till you have a problem. It is actually recommended that every 6 months, you walk into the dentist's office and say, oh, I just want to have a checkup.
And length is so painful. That's why people don't come.
It is painful when you wait until you have pain. Because if you come with a swollen
Just
jaw
yeah.
and then you have to be treated, the procedure will be painful. But you sitting here, if you walk into my office, you won't feel any pain.
I'm just coming for like a checkup, like
Yes,
I'll
a
go and
checkup.
check for my body.
Yes.
Okay.
So, for instance, the thing that I probably might do is there will be something that you didn't notice.
Okay.
I will notice it, but because it is still at the inception stage, whatever I'm going to do, you wouldn't feel any pain. It is either the waiting until pain comes that you would come and get pain.
So ideally, every 6 months, I have
Every
to
6
visit
months,
the
dentist for a
dentist
checkup.
for a checkup.
Right.
Is it the same with children? Do children too have to
Yes.
visit the dentist every 6
Yes,
months?
every 6 months. Everybody should visit the dentist every 6 months for a checkup.
Wow. Now, I want us to delve in about some of the infections or diseases that if we don't take care of our mouth well or our teeth, that we are likely to be infected with. So that at
Right.
least that would put a wake up call for us to really always go to the dentist for a checkup.
Right. So basically, the day-to-day problems that people have usually that do not give them any cause for worry is what we call gingivitis, gingival inflammation. The gums become swollen, reddish, and they bleed.
What causes that?
It's an infection
Oh, okay.
of the gum.
Is it the same
And-
as caca?
No.
Popularly known. Okay.
Caca is actually the holes in the teeth,
Oh,
the
okay.
cavities in the teeth.
Cavities in the
Right.
teeth, okay.
So that infection, because it's not so painful, it's only the bleeding that is the problem. People sometimes overlook it. And then it progresses to what we call periodontal diseases. And that one, it weakens the support of the teeth.
Okay.
So with time, the teeth becomes mobile. So you see, you have no caca, you have no hole in your teeth. But with time, they
They
begin
keep
to shake.
shaking.
And then in the end, you lose them.
Okay.
So that's one way. The caca that we are talking of can actually start from the hole, progress to pain, severe pain, to swelling. And in fact, it can lead to what we call a dental abscess. And that abscess can track to your tongue, push your tongue back to cover your airway, such that you will not be able to breathe. People
Wow.
have died from dental infections.
Huh?
Yes.
Really?
If,
I never knew.
If you go to a teaching hospital now, there are people who are on admission and cannot breathe because the infection has pushed their tongues to fill up the airway.
Yeah, I think there are times we hear people asking for fans because we look at their face and it's like
Yes.
there's a big.
Big. Some of them are tumors, some are cancerous, some are benign tumors. So all starts in the mouth.
But if it's diagnosed early enough.
early enough, yes, it's
Oh.
picked up early enough, it can be treated, and you wouldn't have to go through all that. There are times where you would actually have to go into theater to probably cut part of somebody's jaw away because of an infection, or because of the breathing difficulty, you would have to go and pass something through the
The
nose
nose.
down to the airway so that they can breathe, or else you will not survive.
Oh, I don't think anyone would want to get to that point.
Right.
It's just listening to you. I'm just imagining knowing someone who is going through that and having to struggle to breathe. I want to go for a break, but when we come back, I want us to look at the children growing up. What causes the teeth removing, the new ones coming?
Right.
What is the importance of the new ones with the old ones and all of that? Stay tuned. We'll be right back with more interesting facts.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. things fall apart. Church without bleeding pulpit, singles mingle, and many more.
My name is Dr. Emmanuel Kambere Ujaki, the CEO of Zoe Medical Center, Tamale and at Pamfo. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we become our clients.
Yele, yele, yela, yele. Praise the Lord, oh. Whoa. Yeah. Are you ready? Okay.
Like a rainbow, so my life made colorful. If you don't know, a life with this man is beautiful. Sing to the glory of
Oh, yeah, sing to the glory of God.
Sing to the glory of
Oh, yeah, sing to the glory of God.
It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go. Seek Him first.
Welcome back from the break. Doctor, quickly, let us understand, when I was growing up, it got to a point that my front teeth vanished. And they will ask you to put it on top of a zinc so that a new one would come.
Tooth fairy will come and
So what is the importance of the old teeth going and a new one coming?
Right. So God created the human with a set of teeth that functions for the child up to a certain stage. Then that goes away and the adult ones come.
Okay.
And the adult ones are supposed to take us throughout the length of our life. So if actually you lose your tooth, it is you who has caused it, because they were meant to be there for life.
As a child, when you lose your tooth?
No. As an adult.
Okay, as an adult.
The children, they are supposed to go off after some time. So the first baby teeth comes, as I said, around 6 months. Then that is the lower ones, the lower two. Then the upper two follow. Then the lateral follows. Then the molars follow. So by the age of 3 to 6 years, all your baby teeth are there.
Okay.
They are in the mouth. Then they begin to fall out from 6 going.
Okay.
So the way they came, that's how they go.
Okay.
Now the baby ones, whilst they are there, they are maintaining the space for the adult ones to come. So the adult ones will start shooting under them. When they get close, they cause what we call root resorption.
Okay.
The roots start resorbing or breaking. Then it gets to a point, it falls off by itself.
Okay.
Then the adult one comes.
Okay.
So they will go in that order until all the adult sets are also in around age 12 to 13.
Oh, okay.
By age 12, 13, the adults.
Adult set.
teeth
That's the
set.
full 32.
Yes, but the lower ones, the last ones, where we call the wisdom teeth,
Yeah.
they appear depending on the individual.
Okay.
Some people never have them erupting.
Ooh.
Some people, it comes, but it is delayed. So you can have a 20-year-old and the wisdom teeth haven't come.
Haven't come. Okay.
But ideally, by 13, all should have come.
Okay.
15 years, all should have come.
Okay.
So that is how it is. It's a natural process that takes care of itself.
Okay.
But in that process too, sometimes things can go wrong. Baby teeth might refuse to fall off. Adult teeth might refuse to come where they are supposed to come, and then they come at a different
time.
place. So in that case, you have the arrangement not
The same
good
as,
enough.
yeah.
So we have what we call orthodontic treatment, where we use what we call braces to rearrange the teeth to align them nicely when they don't come out well.
So it's normal, and parents shouldn't be disappointed that from age 6 to 10, their children's teeth are falling off.
No, it's
It's
normal.
normal.
Nobody should be
Okay.
worried about it. In fact, you should rather be worried
Happy.
if they don't fall
Fall
off.
out.
Yes.
But when it falls out, the stronger and the better ones
Ones will
come.
yes.
Okay, so sometimes we hear that when your teeth is brown, when your teeth is white or it's very white, some say that if it's very white, it's more healthier than the teeth which are brownish or any other color.
Right.
How true is that?
Just like the skin of the color
The
of our skin.
The black beauties.
The color of the teeth also varies from person
Person
to
to
person.
person.
Your teeth, though when I smile and you smile, they look white. They don't
Yeah.
actually look exactly the same.
Exactly.
So we have different shades of the white.
Okay.
They are white, but different shades of
the
it.
white. Okay.
Now, even the teeth themselves, the color of the incisors are different from the canine.
Okay.
The shade is different from the canine.
Okay.
So once they are all white, it is normal. Though the shade will be different, just like
Different.
our skin color.
Yeah, yeah.
But you can have problems during development of the teeth. So, for instance, you have a brown teeth that is caused by too much fluoride in your water. So we
Okay.
have what we call fluorosis of the teeth.
Okay.
So again, I mentioned Bongo. A lot
Yeah.
of people from Bongo, you see that the teeth are brownish.
Okay.
So that is what we
Makes
call
my teeth
fluorosis. Again, when the mother of an unborn baby takes certain drugs, certain medications, tetracycline, for instance, during pregnancy or when breastfeeding, a lot of it can accumulate and then affect the teeth. So you would have some brownish patterns on those teeth. Again, development, if you lack the mineral, I told you that the white part is made up of minerals.
Yeah.
So if the mother lacks certain minerals during pregnancy, it means that the teeth are not able to form well
Okay.
and they become chalky.
Okay.
They are like chalk. So those ones are usually not strong
Okay.
and they can easily break.
Okay.
So there is, to some extent, some truth in the fact that the brownish teeth might not be
Maybe
strong.
so
It is the
strong.
chalky ones because
Okay.
their formation was not complete because you lacked or you didn't have adequate minerals to make it strong.
Okay.
So in that case, when you are chewing, they begin to break.
Okay.
Right.
But apart from just that slightest thing, the color of the teeth doesn't really
Doesn't-
show the strength.
No.
And how we have mentioned, either flossing or brushing
Right.
can also be a better way to keep the teeth more healthy.
Yes.
Visiting
Visiting
the
the dentist.
Yes,
There are
that's-
deposits that will usually accumulate on your teeth, whether you brush or you don't brush.
okay.
When you brush, they will accumulate
It's
less.
like bathing. When you finish, when you use the towel will
Yes.
still have some
Yes,
kind
and
of
that's what I
dirt on
always
it.
tell people. You bath every day, morning and evening. Why do you have to bath every day? Because you always have dirt
kind of form of
accumulating.
dirt
So the
accumulating.
same way, there are deposits that would come on the teeth
Okay.
that your brush cannot remove. So when you visit the dentist, there is a machine we use to do what we call scaling.
Okay.
We use that to remove those deposits and stains. Those who take tobacco, those who take cola nuts, they also have those stains on the teeth.
Yeah,
So that can
yeah.
be
Not to
removed.
cast you for just what you just mentioned. Can smoking and those things have? Are they having? Do they have an impact on the teeth or the mouth?
They do. Smoking has an impact on the gum and the teeth. It actually weakens the support of the teeth.
Really?
So those who smoke, apart from the fact that you are exposing yourself to oral diseases such as cancer, you can have mouth cancers as a result
Oh.
of smoking. You also weaken the support of the teeth. So people who smoke are predisposed to periodontal diseases, and for that matter, they will lose their teeth earlier than
They're
people
supposed
who don't
to
smoke.
too.
Yes.
Okay, it's been a very interesting topic. I think our time it won't allow us. So just give us your take-home notes for us to know, for us to keep in our minds, and for us to, especially what parents should look out for in brushing the teeth of their very younger children.
Right. So the point I will stress is the brushing and the visits to the dentist.
Okay.
For children, mothers should supervise their brushing when they are from age 3 years going. Before that, the mother should do it for them. From 3 years, do it and then supervise them to do. 6 years going, they can do it themselves. Important that you do it morning and evening. The evening, as I always say, is more important than
Okay.
the
Because you sleep around that time,
Yes.
and a lot of work goes in while you
Right.
are sleeping.
So it should be the last thing before you go to bed. If you finish brushing in the night, the only thing you are allowed to take is water. Don't take anything apart from
Hey, you can't open the fridge and take at 10 p.m.
apart from water. Nothing again.
Okay.
Right.
Interesting. So quickly, just what should I look out for in brushing the teeth of my baby or my toddler?
Right. So whilst you are brushing, look out for any dark spots, any gum swelling or redness in the gum, any swelling anywhere in the mouth,
Okay.
all those things that appear abnormal to you, then you report to your dentist to have a look at.
Okay, then you report to your dentist to have a look at it. I think it's been a very wonderful and interesting topic. Of course, we'll have doctor again. Please go to Cornerstone Dental Practice, opposite Garba Lodge here in Tamale. When you go, just mention the Reflection Show or Matter, you get a very big discount for just going there and mentioning us. I have been speaking with Dr. Cephas Ayugani. He's a dental surgeon at Cornerstone Dental Practice in Tamale, opposite Garba Lodge on the Bolga Road. My hair is by Bipex Beauty Salon. My makeup is by Makeup Marvin. My outfit is by Roots Suits and More. Shoes by Ennis Collection. Refreshment is being supported by Trillium Industry Limited, producers of McBerry Biscuits, Rush Energy, and Verna, and all amazing refreshment products. Thank you very much to Zoe Medical Center for all your health needs. Please get to Zoe Medical Center for such a wonderful health service. Our set is being supported by Event Happen GH. If you have a wedding, an outdoor corporate event, anything you want someone to organize for you, please call Event Happen GH. You get their contacts on your screen. We are also being supported by Dio Restaurant on the Agric main traffic here in Tamale. For wonderful and sumptuous meals, always go to Dio Restaurants for the best and nothing but the best. My name is Martha Anabila. Thank you very much for watching the Reflection Show. Until same time next week, be safe.
My name is Dr. Emmanuel Kambere Bujaki, the CEO of Zoe Medical Center, Tamale and at Brownford. We are a center of excellence. You are welcome. At Zoe Medical Center, we are endowed with the needed or requisite human resource. We are very much positioned also with our equipment. We have the modern and needed equipment to give you quality service. We run a 24-hour emergency service. We have OPD services also that we run daily. We are able to admit you or detain you on the ward for further observation and treatment. We have a diagnostic unit which is also able to help us with some of our diagnoses, such as we run an endoscopy, we run an ultrasound, and also some blood investigations that we do alongside. At Zoe Medical Center, you are ensured that you will have quality of care. Choose Zoe today, choose Zoe tomorrow, and you will not regret for choosing us. We are here for you, and we will do our best at any time that we come our clients.
Yele, yele, yela, yele. the Lord, oh. Whoa. Yeah, yeah. Are you ready? Okay.
Like a rainbow, so my life be colorful. If you don't know, a life with this man is beautiful. Sing to the glory of
Oh, yeah, sing to
God.
the glory of God.
Sing to the glory of
Oh, yeah,
God.
sing to the glory of God.
It's He I know. Everywhere I go, it's He I see. Anything I do, it's He I go. Seek Him first.
Today on Thought for Martha with Spice, I want every young person to understand that the teeth is really important. It's not just about the discussion we've had or the interview we've had, so you just listen and you go. I want you to take a conscious effort to go and see the dentist this week. I want you to add it to your plans to go and see a dentist this week. If you are a parent or you are a guardian, please take your children to go and see the dentist this week. If you are in Tamale, please go to Cornerstone Dental Practice to see Dr. Cephas. He is going to give people in Tamale a very big, affordable package that you can take your whole family to. We are tired of a lot of young people having cavities and having issues in their teeth or having problems in their teeth, and it's causing serious problems or serious health issues amongst them. We don't want that to happen anymore. So please, go to the dentist this week. Whether you are in Accra, anywhere you are in the world, and you are watching the Reflection Show today, please, I am begging you, to all my mentees and to all the young people that have given me the opportunity to mentor them, please go and see the dentist this week. Our teeth needs to be strong, our mouth needs to be healthy, because we do not want you having bad breath or having any condition that would, like doctor mentioned, sometimes if it's not diagnosed early, you can even have your mouth swollen. And it will not be good for us, because we would have to spend the money that maybe might have been spent on your education, on your health, when it can be prevented. So please, go and see the dentist this week. And this will make me happy. Just do this for me. And just do this for your family. And just do this for yourself. Thank you very much for watching the Reflection Show. My name is Martha Anabila. Until same time next week, be safe and stay strong. And don't forget, you are a winner. Have a good night.